Welcome back to Yahoo Finance Live. We want to update you on what's going on with COVID-19 and, of course, the big announcement from CDC that fully vaccinated people no longer need to wear a face mask indoors or outdoors in most settings. But that simple instruction seems to be creating even more confusion. So let's clear it up. And we invite into the stream Dr. Shikha Jain, Assistant Professor of Medicine at the University of Illinois in Chicago. It's good to have you back. And what's the most important thing you want people to know about this CDC recommendation?
So there's been a lot of confusion, as you said, and there's been a lot of discussion. There are some people in the science and medicine world who are saying that the CDC jumped the gun a little bit, and we're thinking that this should have been done a little bit later when more people were vaccinated. Then there's other people who are saying they're hopeful that these new recommendations will actually encourage more people to get vaccinated. So my biggest take home point is that it is more important than ever to get yourself vaccinated, because once you get vaccinated and you're 2 weeks after your last dose of the vaccine, you're able to take that mask off in certain situations, like when you're indoors, when you're outside socializing. So, my biggest take home from this is get your vaccine as quickly and as soon as you can so that you can be fully vaccinated and enjoy some of these new benefits of being a vaccinated individual.
Doctor, you mentioned the fact that some people out there are saying that maybe the CDC jumped the gun a little bit here. Is there any situation that you would potentially be in where you would still wear your mask?
So I'm still planning on wearing my mask indoors. I have three young children who are not eligible for vaccines yet. They're 6, 3, and 3. So I want to model for them why it's important for them to continue wearing masks. I'm also an oncologist, and so I am seeing a lot of patients who are immunocompromised. So I don't want to bring any extra risk to them. Plus, I personally don't know if I believe that everybody who's inside not wearing a mask is actually vaccinated. As we've seen over the last year, there are many people who have not been wearing masks throughout this pandemic. So there is a lot of concern that there are going to be people who state that they are vaccinated when they actually are not and will be taking their masks off, because right now in this country, we don't have a way to really verify if someone is vaccinated or not. So for me personally, I will be wearing masks indoors for at least the foreseeable future. And I know many of my colleagues feel very similar to the way I feel right now.
Whom poses the perhaps greatest risk, the unvaccinated person to the vaccinated person, or the other way? Because we have that story here in New York. I think it's now 8 people who are part of the Yankees organization were vaccinated but have tested positive for COVID-19. Although we should point out only 7 of them even had symptoms. But where does the threat truly lie?
So the great thing is if you're vaccinated and you end up developing what we call one of those breakthrough infections where you're fully vaccinated, so you're 2 weeks or more out from your last shot, there is a chance that you could still contract COVID-19 because vaccines are never 100% effective. But as you pointed out, the people who develop COVID-19 after getting vaccinated often have mild symptoms, if any symptoms at all. So I'm less worried about myself contracting COVID and getting sick myself, but there is the risk to those unvaccinated people. So we know that COVID 19, the virus, can make you very, very ill, especially if you're not vaccinated. So the biggest risk is to those people who aren't vaccinated, and also those people who say are immunocompromised. So they have an immune system that doesn't mount the robust response that you want to the vaccine. So those are really the people that we're most concerned about getting very ill. But the people who are vaccinated, hopefully the vaccine works for you and you're in that 94 to 95% who don't get it. If you're in that 5% of people who, with the Moderna and Pfizer vaccine, might have a breakthrough infection, your symptoms should not be very severe if you do develop a breakthrough infection.
Doctor, it was interesting. There was this morning consult survey that I came across this morning. It was discussing the fact that 40% of unvaccinated people would get the vaccine if there's some sort of financial incentive to do so. And it could be as low as $50. 40% said that they would get it if they got paid $50, which is pretty substantial when you take a look at some of those numbers there. What do you think of this idea of offering some sort of financial incentive in order to get to that 70 to 75% vaccinated number that we're hoping for?
I think it's a great idea. If it's possible, incentives seem to work for a lot of things. I've seen people at bars offering drinks if you can show you're vaccinated. I've heard of local government officials offering these types of raffles or offering, some type of stipend if you get vaccinated. I've seen places offering all sorts of incentives. So I think if it's going to increase our vaccine incentives to get people vaccinated.
All right. I think we lost you just for the last bit of that, but I have to tell you, I want to invite you back to do a whole segment on remaining calm and collected when you're not only a doctor serving the community you serve, but you've got a 6-year-old and 2 3-year-olds at home. That is worthy of a discussion. We appreciate your being here, Dr. Shikha Jain, Assistant Professor of Medicine, University of Illinois, Chicago.